I think that we are at a juncture or a pivotal moment or at the crossroad, you can call it whatever, but basically we are now at a very critical moment when it comes to the future of Europe's healthcare system. Because our healthcare model, we all know, is unique in the world. It is based on two very simple principles. First is that everyone should have access to the very best treatment and high quality care, no matter where they live in the European Union. But we also know the reality. And the reality is that this model is coming under enormous pressure. First of all, Europe is aging very fast, maybe the fastest in the world. Chronic diseases are on the rise. We will see the number of people with chronic diseases double in the next 25 years. And our healthcare workers are stretched. It is also clear from this that our health systems are already being asked to do more, but they will be required to deliver more. And we also see that they have to deliver this with the same or even tighter resources, and they have to face a growing demand. At present, we are missing an estimated 1.2 million doctors, nurses and midwives across the EU, although these shortages are of course not evenly spread across the EU or even within member states. The wider health ecosystem is also under pressure. European companies that develop medicines and medical devices often struggle to turn excellent European science into products and therapies and bring it to the patients while being able to compete globally. Too often our brightest innovators have to take their ideas outside Europe to scale it up and make it a success. No European country on its own can offer the market, the capital, or even the regulatory weight to compete at a global level. We see this every day. But Europe, acting together, can and should. This is why we need bold, coordinated action. Action to strengthen our health workforce, action to give them the tools they need to deliver for the patients, and action to make our healthcare system more resilient for the future. Ladies and gentlemen, a secure and resilient healthcare system starts with its people. The doctors, the nurses, the pharmacists, and many other specialists who care for the patients, day in, day out. National governments are, of course, responsible for their own health workforces, but the EU can support them in this work. Through the EU for Health funding, you all know, the Joint Action Heroes is helping countries to improve their capacity for workforce planning. And I'm also pleased that our host Latvia is moving forward through its healthcare workforce development strategy. It shows that, of course, national leadership, supported by EU funding and technical assistance, can deliver lasting reforms. We are also working with the Member States on a range of measures to help address healthcare workforce shortages. This includes improving working conditions, supporting training and upskilling, and helping, of course, the Member States retain and attract health workers. It also means improving workforce planning on data, so shortages can be better anticipated earlier and addressed more effectively. And here I would put a footnote. You have all seen the Safe Hearts Plan. You have all seen us trying to push for the promotion of prevention as a very powerful tool to rebalance not only the budgets but also the healthcare systems of the member states to be able to deliver more from the same resources, be it human, be it financial. And since we are here with member states and countries of population around 2 million or below, you have the potential to deliver this first. You could be the pilot for the rest of Europe to deliver on this, because with lesser investment, you could actually run ahead of us and show us this model working in reality, and the Commission would be a partner for you to do that and achieve it. This is why the Biotech Act was proposed. This is why the Safe Hearts Plan is proposed, so that we can start to change the healthcare system as we know it, spend more on prevention, use the powerful tools of digitalisation, artificial intelligence, much more effectively, so that the workforce that you have and the budget that you have will be able to meet the challenge that we all face. Through the European semester and the Recovery and Resilience Facility, the European Social Fund Plus, and the EU for Health, of course, the Commission supports the Member States in reforming the health system, strengthening also the workforce and investing in staff. We have also launched the Nursing Action together with the WHO Regional Office for Europe to strengthen the recruitment and retention of nurses. We also support health professionals by connecting expertise across through the 24 European reference networks. I think this is one of the biggest successes that we have seen recently, because they help specialists work together on rare disease cases, so that the patients, and especially in small countries, can receive the right diagnosis and the treatment even when the expertise is not available locally. So, ladies and gentlemen, prevention is essential, as I already mentioned, for any resilient health system, and it's one of the priorities of this Commission. Because preventing a disease is far more cost-effective than just treating a disease, and it reduces the burden on health professionals. In the Europe's Beating Cancer Plan, we have already a very strong focus on prevention, because we know that when it comes to cancer, 40% of all the cases are preventable. During the 5 years of implementation of the Europe's Beating Cancer Plan, we have invested 2.5 billion euros, and 90% of the actions of the plan are either completed or already on the way. The plan, of course, recognizes also the value and the need of well-trained health workforce as being critical on delivering the plan. The project Interact Europe 100 is about setting new standards of teamwork in cancer care, with a comprehensive training program across more than 100 European cancer centers. Cancer and cardiovascular diseases are the two leading causes of death in the European Union, as we all know, and they share many of the same root causes, and here we are talking about 3/4 of all the deaths in Europe. As many as 80% of the cardiovascular cases could be prevented. So it was for that reason that last December we adopted the first ever European cardiovascular health plan, the Safe Hearts Plan, as part of our health package. We have tried to set very clear and also achievable goals. Just to mention the most important, we think we can and we should reduce cardiovascular mortality by 25% by 2035. This means adding 2 more years of life expectancy to all Europeans. This means 2 more years of life for everybody. The Safe Hearts Plan is fully aligned, of course, with the Cancer Plan by strengthening the prevention and action on shared risk factors. And better data on inequalities will also help us target action where it is needed the most. Now turning to the sustainability of our health care systems, of course the first topic that comes to mind is that we need to embrace innovation even more. Innovation means faster diagnosis, means better treatments, means safer devices, and means new hope for patients. This is why the Biotech Act is a central part of our health package. We are convinced that biotech offers the promise of personalized diagnostics and treatments that deliver better results for patients much faster. But too often in Europe, science does not translate easily into commercial success and treatments. So the Biotech Act is designed to tackle this gap. It will make it easier for European innovators from countries large or small to grow and scale up in Europe. It will speed up the approval process for clinical trials. It should support complex products and unlock the potential of artificial intelligence, and should mobilize new investments, including through a 10 billion euro pilot initiative with the European Investment Bank. We have also proposed to simplify the rules on medical devices. Medical devices help health professionals deliver care. More and more we see that medical devices are going to be indispensable elements of the new therapies. From pacemakers to MRI machines and glucose monitors, diagnostics, and the next generation of AI-enabled tools, we all know that this is not the future, this is already the present. But the rules of these devices have become too complex and too burdensome. This matters especially for the small businesses and the small countries, where the withdrawal or the absence of a device can have a major impact on patients and professionals. Our proposal will help devices reach the patients faster. Health professionals also need medicines to be accessible and available. The reform of the EU's pharmaceutical legislation, now agreed between the Parliament and the Council, will help us to ensure that the medicines are safe, effective, and available for patients when they need them and wherever they need them. It also includes a mechanism allowing member states to request that an authorized medicine to be placed on their market is actually followed through. Finally, complementing the pharma reform, the Critical Medicines Act will reduce Europe's resilience on single suppliers of essential medicines. Here I want to congratulate the Cypriot presidency, who has concluded the negotiations at record pace in the first half of its presidency. And now we have an agreement between the Council and the Parliament. This is a major achievement, especially if I look around the table for this group of member states, because it was meant and designed to address the shortcomings you are facing the most in Europe. It should also help to ensure that the measures to secure supplies in one member state does not create a shortage in another one. It will also provide a market tool through collaborative procurement tools that can pool demand, that can strengthen the bargaining power, and that can create markets we have not seen before, markets that will make it economically viable to supply member states of 2 million or less population. So, ladies and gentlemen, these are the building blocks of a healthier, more resilient, and more secure Europe. A Europe where all countries, big and small alike, have the workforce they need. A Europe where the workforce is skilled, supported, and equipped. And a Europe where patients can benefit from the latest medicines, technologies, and medical devices wherever they live. And this is the promise of European cooperation in health. No country has to face these challenges alone, and no country can face these challenges alone. Thank you very much for the invitation, and thank you very much for your attention.